So let's try to answer this question. Label each diagram as either head first supine, head first prone, feet first prone, or feet first supine. So the first part of each one of those acronyms, head first or feet first, just refers to which part of the patient is closer towards the LINAC or the CT machine. So head first, that means their head is going in first. Feet first, their feet is going in first. That part, very straightforward. Now, prone and supine, you just gotta know the definition that prone is on their stomach and supine is on their back. So in this patient, they're going in head first and they're on their back, so they're gonna be supine. Let's try in this case. This patient is going in feet first, and they are laying on their back, so they're supine. What about this patient? You might have guessed it. They are head first, but they are prone, head first prone. What about this case? The patient is still prone, but they're going in feet first. So these positions are relatively straightforward, but you might have trouble knowing your left or right from the patient's left or right. So to know your own left or right, if you struggle with that, is to hold up both of your hands, try to make the letter L. Now, the one with the correct orientation is going to be your left hand, so that is your left. The patient's left is either going to mirror you or it's going to be the same as yours. So, if you're at the edge of the table, say this is you, right? This is your right hand, and this is going to be your left hand with the correct L, right? So, that's your left, but this is not going to be the patient's left, okay? This is going to be the patient's left. This is going to be the patient's right. Now, you want to try to imagine that for each one of these. Now, imagine you're at the feet of a patient that is head first prone. Can you label the patient's left or right? Pause the video and try. Okay, so the patient's right is actually going to be the same right as yours, and their left is also going to be as same as yours in this case. Now try to label the patient's right in this case. You're again pointing towards the patient. So this is gonna be the patient's right, and this is gonna be their left. So again, pause the video to try to find out where is the patient's left or right. Okay, so this is gonna be the patient's right, this is gonna be the patient's left. Now take your time and really try to answer each one of these questions for each one of these patients. So, assuming you pause the video and want you to compare your answers. Alrighty, this may or may not make sense. So, I had another way of drawing it out. I drew the patient with no shoes and a little hat to show the orientation. Now, for your test, depending on your school, you might hear some of these positions being thrown around, but really, the one I want you to focus on for clinicals is going to be left or right decubitus. So decubitus just means laying on their side. So right lateral decubitus is the patient laying on their right side, and the left lateral decubitus is the patient laying on their left side.